Just last week, a patient in their early 60s walked into my clinic with a blood pressure reading that immediately concerned me. 168/96. They looked confused, even frustrated. What they told me surprised them, but not me. They said, "Doctor, I don't understand it. I eat what I think is healthy. I don't add much salt. I try to stay active. So why is my blood pressure still high?" But when I asked about their morning routine, everything became clear. Every single morning, they were starting the day with orange juice, toast, and a cup of coffee on an empty stomach. A routine millions of people follow without realizing it may be silently increasing vascular stress, blood sugar spikes, and arterial stiffness over time. And here's what most people don't realize. High blood pressure is not just about salt. It is not just about age. And it is certainly not something you just inherit and live with. It is a dynamic, reversible physiological state influenced by daily habits. I'm Dr. William Cooper, and with over 20 years of medical experience, I have treated countless cases of high blood pressure. In today's video, I'm going to show you exactly how to lower blood pressure naturally using clinically supported, practical strategies that I have personally seen work in patients in their 50s, 60s, 70s, and even 80s. But stay with me, because at the very end, I will reveal the single most powerful habit I give my own patients. Most people completely overlook it, yet it often makes the biggest difference. Before we talk about solutions, we need clarity on what blood pressure actually is. Blood pressure is the force exerted by circulating blood against arterial walls. When arteries are flexible and open, blood flows easily. When they become stiff or narrowed, pressure rises. As we age, several changes occur naturally. Arteries lose elasticity, inflammation increases, endothelial function declines, blood flow resistance rises. But lifestyle factors dramatically accelerate this process. In my clinical experience, the biggest contributors are not isolated. They are cumulative. Poor diet, chronic stress, inactivity, poor sleep, and dehydration. The important insight here is this. High blood pressure is not just a cardiovascular issue. It is a whole-body regulatory imbalance. Let's begin with the morning, because this is where many hidden triggers exist. A large number of seniors unknowingly start their day in a way that spikes cortisol and blood glucose simultaneously. Sugary breakfasts, refined carbohydrates, and caffeine on an empty stomach can trigger a stress response that tightens blood vessels. One patient told me, "I thought breakfast was just breakfast. I had no idea it was affecting my blood pressure." When we modified their routine, removing juice and replacing it with protein-rich meals like eggs, Greek yogurt, and nuts, their systolic pressure dropped significantly within 3 weeks. Now, I am not suggesting extreme diets. I am suggesting physiological awareness. Start the day with protein, healthy fats, fiber. Avoid sugary juice, white bread, refined cereals. For decades, people have been told that salt is the enemy, but the reality is more nuanced. Sodium is essential for nerve signaling and fluid balance. The real issue is excessive sodium from processed foods combined with potassium deficiency. Most of the sodium people consume is hidden. Canned soups, frozen meals, fast food, packaged snacks. This creates a chronic imbalance that promotes fluid retention and vascular strain. Instead of fearing salt entirely, focus on reducing processed foods, cooking fresh meals, balancing sodium with potassium. If this information is helping you understand your health better, take a moment to like the video and share it with someone over 50 who needs to hear this. It genuinely helps us reach more people who are struggling silently. If sodium increases pressure, potassium does the opposite. Potassium helps relax blood vessel walls, improves kidney function, and supports sodium excretion. Many adults over 50 are mildly deficient in potassium due to modern diets. Increasing potassium intake has been associated with reduced systolic blood pressure, improved vascular flexibility, better fluid regulation. Food sources include leafy greens, sweet potatoes, avocados, beans, and lentils. One of the most underrated interventions is also the simplest: walking. You do not need high-intensity exercise. You need consistent movement. Walking improves endothelial function, circulation efficiency, heart muscle strength, stress regulation. Even 20 to 30 minutes daily can reduce systolic pressure over time. I have seen patients in their 70s reduce medication dependence simply by committing to daily walking. If you are still watching, comment, "I'm committed," because consistency, not perfection, is what changes outcomes. Stress is one of the most powerful drivers of hypertension. When the body is under stress, It releases cortisol and adrenaline, causing vasoconstriction, increased heart rate, elevated glucose levels. Chronic stress keeps the body in a constant fight or flight state. Simple interventions such as deep breathing, meditation, prayer or mindfulness, quiet walks can significantly reduce blood pressure in some individuals within minutes. Sleep is when the cardiovascular system repairs itself. Poor sleep disrupts hormone regulation and increases nighttime blood pressure. Adults over 50 should aim for 7 to 8 hours of quality sleep. Key improvements include dark sleeping environment, reduced screen exposure, consistent sleep schedule. Hydration directly affects blood viscosity. When dehydrated, blood becomes thicker, increasing resistance and pressure. Proper hydration supports kidney filtration, improves circulation, reduces cardiovascular strain. A simple but powerful habit. Drink water consistently throughout the day, not all at once. Now let's move deeper into how your heart and blood vessels affect blood pressure. Your heart is like a pump. With each beat, it pushes blood through your arteries. When those arteries are flexible and open, blood flows easily. But as we age, and with stress or poor diet, arteries can stiffen or narrow. That makes the heart work harder and raises blood pressure. A patient once told me, "Doctor, I thought I was doing enough. I walk every day." That's great, but exercise isn't just about movement. It's about strengthening your heart too. When your heart muscle gets stronger, it pumps more efficiently, and blood vessels relax a bit. Think of gentle cardio, even 10 minutes of brisk walking daily, as heart strength training. Over weeks, even this small daily habit can lower the pressure on your arteries. In fact, I encourage patients to do quick self-checks. One grandmother I know walked in place for 1 minute every morning and then checked her pulse. As her fitness improved, her resting pulse slowed, and her BP readings improved. Seeing real progress kept her motivated. Quick tip: if your heart ever feels like it's fluttering or racing, don't ignore it. Listen to your body and check your blood pressure or call your doctor. Often it's just harmless, but sometimes it's a clue to cut back on caffeine or stress. On the other hand, don't be afraid to move. Gentle exercises like marching in place or light dancing can be very safe and heart healthy for most people. Next, let's talk about the kidneys, the unsung heroes of blood pressure control. Your kidneys filter about a half cup of blood every minute, removing waste and extra water. They also manage hormones that regulate pressure. When blood pressure stays high for too long, it scars the tiny arteries in the kidneys. Damaged kidneys then can't filter as well or balance salt and water. This causes fluid retention and triggers a hormone system, renin-angiotensin, that raises blood pressure further. In short, high blood pressure can damage your kidneys, and impaired kidneys can make blood pressure harder to control. That's why we always say, protect your kidneys by managing your blood pressure. Keep drinking water to help filtration, and keep salt low so kidneys don't have to work overtime. Check for ankle swelling or puffiness, a sign you might be holding on to fluid. A patient once noticed her shoes were tight in the evening. Simple change, cutting out packaged soups, and soon her ankles were normal. Also, ask your doctor about kidney protective medications, like ACE inhibitors or ARBs, if you need them. They not only lower pressure but shield the kidneys. And if you have diabetes or kidney disease, this is even more important. Simple at-home test. Once in a while, dip a strip in your first morning urine, some pharmacists sell them, to check for excess protein, just to keep an eye on your kidneys. Now the liver. It plays a role too, mostly through metabolism. A fatty liver, common in older adults, is linked with insulin resistance and hypertension. Too much sugar and trans fats can clog up the liver, leading to inflammation and higher blood pressure. One Harvard study even notes that fatty liver disease and high blood pressure often go hand in hand due to metabolic effects. Keep alcohol in check. Even moderate drinking has been shown to raise blood pressure. Current guidelines say no more than 1 drink a day for women and 2 for men, and all would benefit from drink-free days. Replace one evening cocktail with a non-alcoholic option, like sparkling water with lemon. Also, support your liver with green veggies. Cruciferous veggies, broccoli, cabbage, and beets help detoxify and may improve blood flow. I remember a patient who loved beer with dinner. When she cut back and switched to herbal tea, her blood pressure began to fall. Speaking of tea, try hibiscus tea as a healthy habit. Research shows 3 cups daily lowered systolic BP by over 7 points in people with prehypertension. So sip a calming herbal tea in the evening instead of alcohol or dessert. Let's double check your medicine cabinet and lifestyle. Some over-the-counter meds can nudge your pressure up. Non-steroidal anti-inflammatories, NSAIDs, like ibuprofen or naproxen, are common culprits. Studies show regular NSAID use can raise blood pressure and blunt the effect of BP meds. For aches and pains, use acetaminophen, Tylenol, first, or ask your doctor for alternative strategies. Similarly, many cold and sinus remedies contain pseudoephedrine or phenylephrine. Avoid those if you have hypertension and opt for saline nasal sprays instead. Also, check all supplements. Even natural supplements, like high-dose vitamin E or licorice root, can raise pressure. Always mention any herb or vitamin to your doctor. They can interfere with medications. Alcohol fits here too. It's a drug that affects your cardiovascular system. Excess alcohol keeps your blood vessels tight and heart rate up. As the AARP points out, even moderate drinking may be riskier than we thought. Try healthy substitutes: kombucha, herbal teas, hibiscus green tea, or simple fruit-infused water. If you're on pills for diabetes or cholesterol, take them as prescribed. These also affect blood pressure indirectly. Missing doses can let your sugar or cholesterol rise, making BP harder to control. If you're finding these tips eye-opening so far, do me a quick favor. Hit the like button and share this video with someone who's trying to lower their blood pressure. The more people we reach, the more lives we help. Next up, tracking your numbers. Having a home blood pressure monitor is like owning a personal doctor's office at home. Choose an upper arm cuff device and make sure it's clinically validated. The AHA recommends the validated BP.org list. Wrist monitors are convenient but tricky to use correctly. Use it correctly. Sit upright, feet on floor, back supported. Rest quietly for 5 minutes before measuring. Take 2 readings a minute apart each time and record both. Do this at the same times each day, for example, morning and evening, and log it. A simple notebook or a phone app works. Tracking helps you see trends. For instance, you might spot that afternoon readings are higher, so you'll know to avoid a heavy lunch. One of my patients thought her meds weren't working, but we discovered she'd been measuring right after gardening. Once she rested first, her readings were much lower, and we realized she just needed a bit of rest before measuring. Also, weigh yourself weekly and check your ankles. Sudden weight gain or swelling can mean fluid retention, alerting you to cut salt further or see your doctor. Simple home tests include checking your pulse for a full 60 seconds. A healthy resting pulse might be 60 to 75. If yours is above 80 for long periods, it can signal stress on your system. Let's make blood pressure healthy eating easy and delicious. First, swap snacks. Grab a handful of unsalted nuts, walnuts or almonds, instead of chips. The nuts give magnesium, healthy fats, and protein to keep you full. Keep fresh fruit on hand. Berries, oranges, or a banana with peanut butter can curb cravings and add potassium. At meals, aim for the dash approach. Fill half your plate with colorful vegetables, spinach, bell peppers, carrots, a quarter with lean protein, fish, chicken, beans, and a quarter with whole grains, brown rice, oats. For example, make overnight oats with yogurt, berries, and a dash of cinnamon for breakfast. It's fiber-rich and potassium-rich. Add spinach or tomato to omelets, or snack on baby carrots with hummus. One fun trick: make smoothies. Blend banana, berries, a handful of kale, and low-fat milk or yogurt. You get fiber, potassium, and calcium in one glass. The AHA even shares recipes like blueberry smoothies that seniors love. Coffee and tea can fit in moderation. Green tea or hibiscus tea, hot or iced, are great. The USDA found that 3 cups of hibiscus tea daily cut systolic BP by 7+ points. Try a hibiscus lime iced tea mid-afternoon instead of soda. If you crave something savory, roast or air fry small potatoes or beets with a bit of olive oil and garlic instead of eating fries. Berries, raspberries, blueberries, contain nitrates that naturally relax vessels, just like your veggies. And don't forget dark chocolate. A small square of 70% dark chocolate once a week can gently dilate arteries and make you feel good. Hey, by now you're gathering a lot of life-saving tips. If this content is making a difference, please subscribe for more and comment below "ready" if you're going to try one of these recipes this week. I know making changes isn't always easy. You might feel overwhelmed. I've done everything and still have high BP, or I have no energy for all this. Let's address the common roadblocks. Taste fatigue. If low-salt food tastes bland, ramp up herbs and spices. Garlic, lemon, basil, and paprika add flavor without sodium. One patient's wife was bored of salt-free soup, so we made a quick chimichurri, parsley, olive oil, vinegar. It turned the dish into a new favorite. Physical limits. Joint pain? Don't give up on activity. Try seated exercises or gentle tai chi. Water exercise is fantastic. Even walking in the shallow end works muscles without joint stress. Time constraints. Cooking fresh can be hard with a busy schedule. Use a slow cooker. Throw in beans, tomatoes, garlic, and herbs, and let it simmer. Or buy pre-washed salad greens and add chopped chicken or tuna. Healthy meal in seconds. Motivation dips. Find a partner. An accountability buddy, even a friend on a video call, makes you less likely to skip workouts. Remind yourself why you're doing this. For your independence, to avoid heart attacks, to feel better day to day. Keep a journal of how small changes make you feel more energized or get you off of BP medication. That feedback loop is powerful. Remember, each small step counts. Even if you slip once, get back on track. In my clinic, I've seen 70-year-olds double their walking time in a month, or diabetic patients halve their BP medications with concerted lifestyle change. It's never too late. You've been committed all this time. Now here's the most important concept I've saved for last. You probably expected a new superfood or miracle pill, but the truth is simpler. Consistency is more powerful than perfection. It's not one big change. It's doing these healthy habits day after day. Your health isn't changed by one moment. It's built minute by minute, day by day. Keep showing up for yourself. No matter your age, these consistent choices add up to years of vitality and independence. You've got all the tools now. Apply them, and you'll see the changes yourself. Please keep in mind that this video is for informational purposes only and does not constitute medical advice. If you notice any health abnormalities or before making changes to your treatment plan, please consult your healthcare provider or a qualified physician. Thank you for watching this deep dive on lowering blood pressure naturally. If you found it helpful, share this with someone who needs it. Your best years are still ahead. Let's make each one healthier than the last.